and take a seat in the waiting room. She'll be with you shortly.
Little ouch. That's it. That's it. That's it.
Because we are wondering about the possibility of leukemia, that means we have to move quite quickly.
So he has an infection in his chest, but he's also a bit heavy.
Am I feeding him too much?
I think so, yes, I think so.
If the same gets prolonged for more than 30 seconds, then sometimes some people have sudden cardiac death as well.
Had you had any suspicions about your hearing?
Oh, I'm fed up with asking people, what did you say? What did you say?
They can book you in for a blood test.
Another blood test?
Yeah.
I'll have to come in for a transfusion, I will.
Chelsea Pierce. Hi. Come through, have a seat.
In the last 2.5 months, I've been on 2 different types of contraceptive pills, and they've constantly made me bleed. And the last one that I was put on, I stopped about 2 weeks ago. It made me bleed even worse. I'm still bleeding now, and it made my moods really bad. And I was taking out my partner all the time. Like, I was shutting myself in my bedroom. So I was just wondering if it would be possible if I could try the contraceptive patch.
Okay.
I've been on 4 different pills now, and I've had the implant done as well, and they've all done the same thing.
When did you have your baby?
She's nearly 4 months old.
Are you breastfeeding?
No.
Planning on having any more soon?
Not for a few more years, no.
Okay. So you've got the pills that you know about. You've got the injection.
Yeah.
You've got the implant. You've also got the coil.
I can't have the coil. I've got 2 wombs and 2 cervixes.
Okay, that might be a problem. That might also explain why you have heavy bleeding. Did you have heavy bleeding prior to starting contraception as well?
My periods were normal because I had an operation in 2013, and that's when I found out. But previously, before that, they were fine.
Okay.
But now that I've been on the pill, they've just seemed to make it worse.
So today we're looking at your fingers. Which one's the one that's causing you the problem?
This one.
How long has it been a problem for?
Forever.
Forever? And tell me what happens to it.
When I fold it over,
it
locks.
OK. And where do you feel that's catching?
Just in there.
Yeah, strangely, it probably isn't. It's probably further down here that it's causing the problem. So, and in fact, you can feel a little nodule in there. This is called a trigger finger. And what happens is that you've got muscles in this part of the arm that end up in tendons that go and insert into different parts of this. And they contract these muscles and it pulls the fingers down.
Okay.
Now, for these tendons to work, they have to go through little sheaths. And sometimes what happens, you'll end up developing a little bit of inflammation inside there, a little nodule forms. And as it goes through the sheath, you pull it down and it gets caught and it's harder for you to open it up again.
Yeah, that's it.
Okay. What we could try to do for you is pop a little injection in here that sort of sits between the tendon and the sheath. And it's a little steroid injection. And the idea is to reduce any inflammation that's there and allow that to settle down so that it works properly.
OK. Will I cry?
Hope not.
The patch is an option to try, but it contains the similar type of hormones we just gave you now.
Okay.
There's lots of different pills we can try and things, and so you've just had the combined pill. It's a mixture of estrogen and progesterone, and that's exactly what the patch is.
Oh, okay.
When you first had your baby, you were just given progesterone only. It's that particular hormone that can have an effect on your bleeding pattern.
Oh, okay.
And the trick is we need to find a type of progesterone that's going to work for you. So I'm going to try you a different type of pill. And you haven't had this type of progesterone. It's one of those ones that we would use if we were trying to stop bleeding. Hopefully, it will have a better effect, OK? But again, if it's, see how it goes, give it a month. If it's not working, you need to come back in.
OK.
We will get there, Chelsea. OK.
Fingers crossed.
Good. Fingers crossed. Exactly. All right. But like you said, give it a month. If it's not helping, come back and we'll see what we can do. OK.
Thank you very much for your help.
No problem. You take care.
See you later.
Bye bye.
Getting all nervous now.
OK, just pop your hand up here for me. That's good. I'm just going to give that area a bit of a clean. Right.
Oh, I'll have to look away.
That's absolutely fine. You look anywhere else. Okay, a little prick now. Well done. Well done. Put that on there.
Yeah, I felt that.
Sorry?
Felt that. It's making me sweat.
OK, so that's done. So what I suggest is over the next few days, just take some Nurofen or something like that just to try and help if it's painful. If in 6 weeks' time you feel that it's no better, then give me a call and I'll get you back in again.
OK.
OK?
Thank you very much.
OK, mate?
I'll wipe my forehead now.
See you later.
See you later. Thank you very much.
Bye-bye.
Can I have your pen? No. Oh, yeah. It's a cool one, too. Why don't I get nice pens like that?
Hi, Michael. Come on in. Take a seat. Nice to see you.
Yeah,
I haven't seen you in a long time.
Been having a lot of problems still.
OK.
Back here to find out what the results were from the blood.
Yeah, you had some blood tests, didn't you? OK.
Time spike and white blood cells or something.
Yeah, that's right. And you mentioned that you've been feeling unwell.
Yeah.
Tell me a bit more about that.
Last week it's been awful. I keep dry reaching. I'm just eating toast and drinking lots of fluids. I'm not going to the toilet at the same time though.
Okay.
It's just stomach reflexes,
Yeah.
dry reaching. There's nothing coming out except just pile water, you know.
Any other things that you've noticed? So the dry retching.
I'm constantly tired and I can't sleep. I can't. I probably have 2-3 hours of sleep a day.
Yeah.
I have this weird rash that's appeared all over my body.
Yeah.
My legs and everything is, but they don't know what that is either.
Right, OK.
There's a lot going on, there is, you know, but they just can't get it all on me. It's all around me, stomach and everything it is.
All right. With the symptoms that you're describing here, Michael, and I think when you saw Dr. Lee, you mentioned that there was a family history of a blood cancer, so leukemia.
Yeah, my sister.
That was your sister. That's something we need to keep in mind because actually the results have come back. And if we tie in your sister having had leukemia, the kind of symptoms you've got at the moment, and your blood results which show that your white cell count is a little bit raised, we do need to be looking into getting this checked out in far more detail than just a blood test. So the next step would be getting you seen by a haematology doctor, that's a blood doctor, to ask the question, what could this be? Why has Michael's blood cell count, why has that gone up? And letting them know that there is this family history of leukemia. And I would also want them to know that you've got this collection of symptoms, tiredness probably being the main one, which may tie in with potentially something like leukemia.
Cheeky boy. Hello, what are you doing? You're not going to smile at the doctor today, no? Cheeky boy, aren't you?
And who's this?
What's your name?
Your big sister.
Brother, sorry. It's your long hair, it's lovely.
It's okay. Right, hold still.
No. It's all right. You're a brave boy.
Look at his face. He's having us on, aren't you?
Cheeky boy. Good boy. Cheeky. Come on. Cheeky bum. Oh, you've been sick.
Darren Davis, please. Hello. You're 3 now, are you? Oh, you're getting a big boy. Right. Hello, you've got 2 of us today.
How are you?
He's 3.
3.
So my name's Julie, this is Andrea.
That's my mummy.
That's your mummy, yeah. So because you're a big boy now and you're going to nursery and soon you'll have to go to school, won't you? To big school.
Yeah.
Yeah.
So because of that, we have to give you some little injections. Yeah? So one little injection goes here and one little injection goes there. Okay? It's just a little ouch. Yeah? Very quick. And then we'll get you some stickers. Yeah?
Yeah.
Yeah, you like stickers? Yeah. So you're going to sit with Mummy and be a brave boy? Just leave that there for now.
Superman.
Wow, Superman! You got muscles like Superman? Whoa, big muscles! Mummy's going to give you a nice big cuddle. Okay, so you're just going to feel a little ouch. Okay, nice and still for me, darling. Oh, sorry. Little ouch.
Ouch.
Good boy. I know, sorry. That's it, that's it. That's it. That's it. Good boy, well done. Right, one more little ouch. That's it, good boy. All done. That's it, finished. No more. All finished now. Good boy, well done. That's it, all finished now. So you can give him some paracetamol, some Calpol to get home. If you want, it's fine. Do you want to take it off? That's it. You want to do it, shall I? That's it, that's it. There we go. And this one. That's it. I'm sorry, you didn't like that, did you? There we go, that's it. It's all fine now. You're all done now. You don't need any more. You're all finished.
now.
Do you want your sticker now? Where do I put it? There it is. That's it. That's it. Brave for the nurse.
You've got one.
You want the whale one? Did you want the whale one instead? All right, you can have two then, because you had 2 injections. Yeah?
What do you say?
There we go.
What do you say?
All right, good boy.
Right, you can sit down there.
All right then, bye-bye.
Thank you. So have a nice day.
You too, bye.
We cannot say for sure that that's what it is at this stage. We are probably just getting a hint that something's not quite right.
Can we get this done quick?
Yes, absolutely. So because we are wondering about the possibility of leukemia, that means we have to move quite quickly. When we deliver potentially serious or bad news to patients, it's extremely important to be very clear in your communication, to recheck that patients have understood what you've told them, and to actually give the patient some time to absorb and understand what it is that is being discussed in the room. You will get contacted by the hospital tomorrow, and they will arrange to see you, and urgent on the NHS means that you get seen within a 2-week window. You would then see a specialist, a haematologist, okay? They would then have a look at this, decide what the next steps are going to be in terms of assessing you, any further tests that they need to do, and it would start the ball rolling.
Okay.
Okay. I know it's not the easiest thing to hear from a doctor. At the moment, we don't have a diagnosis.
So we just have to wait and see what the haematologist
We do need to get this looked into, yeah. And so, of course, I'll arrange that urgent referral today.
What do we need to start doing to make this better?
So I can't advise you on that, Michael, just because we don't have a cause for this yet. We haven't made a diagnosis. Say we find a reason why you're feeling this tired, that's going to allow us to then work out how best to manage it and treat it for you. Okay, Michael?
Do we need to... I just have to wait for the letter from the hospital, really?
Contact from the hospital either tomorrow or on Wednesday, and they will make you an appointment to see a specialist, and that's all done in a short space of time, and we go from there. All right. You're welcome.
All right, Doctor.
Take care.
Got a headache. Honestly, I think it's these lights. It is. I get a headache every day. To bring my sunglasses in. Sit here with my sunglasses on. Your sunglasses.
What's the latest, mate?
I'm still having problems with my head. I'm getting really severely depressed. The drugs I'm on are not really helping. The only reason I really get up in the day is because I've got a dog and the dog kicks me out of bed. It bites me to death.
Do you want to change your antidepressant?
Well, if it's not working, it's not working, is it?
I know, but there's a limit to what any of them might be able to do, David. Do you know what I mean? That's the problem.
Well, yeah, but even my painkillers don't seem to be working, or maybe it's just because I'm feeling so low.
I think that will be part of it. Okay, so we'll change it around. Okay, so we'll change you to a. So you need to stop the fluoxetine.
All right.
Okay, which you're taking 2 of at the moment. Then start with just one of these ones. Okay, and we'll see you in 3 weeks.
I mean, drugs will only do, as you say, do a certain amount. Maybe I should go on a cannabis or something. Yeah. I'll send you a bit paranoid, innit?
Can in some people. My son's about to go off to Amsterdam with his mates. Can't wait
What, a rugby talk?
No, just yeah.
Right, well, I was going to say, Joyce has rugged this out. Can we have 2 months' supply of it?
Yeah.
You know, when I come to see you, I don't come with 1 or 2 little things. You should know that.
Mate. I know. I should put you
I mean, you walk past
appointment.
with a bloody mug in your hand with some liquid in it. You didn't even offer me any, you know?
No, I didn't. No, because it's bad for you.
Yeah.
That's your medication.
No problem. I'll see you if I come back.
Why, you away?
Yeah.
Where are you going?
Spain.
Okay, mate. Enjoy yourself, yeah?
Yep, no problem. And
you probably will. I mean, you know, it's probably the best thing for you to do at the moment, just to get away.
Oh, yeah.
You know.
Just chillax and...
Yeah.
I mean, it's only 35 over there at the moment, so... It's down the beach, in the sea. I find it more... I don't know, maybe it's better in swimming in the sea than I do in the pool.
So that salt water makes more point, mate.
Yeah, that's it. You know what I mean? I better go to the Dead Sea then, aren't I? All right, Davey boy. Yeah. All right.
I think I need glasses because sometimes, you know, like if I'm looking at a prescription, I'm like this.
Yeah, it gets all fuzzy.
But they said to me, no, your eyes are fine. I have to get a pen and hold it this, look at the top for 3 minutes, then look away.
What?
And then bring it closer and look away. I thought that's not going to bloody work, is it?
Yeah.
I'll be ended up with eyes like this.
What size?
Hi.
Joseph Case, please. Okay, have a seat.
Thank you.
Okay. How can I help?
It was two things, actually.
Yep.
One, I'm on sertraline, and I was wondering if that could just be bumped up.
Okay.
I'm fine on it, etc., but just lately I'm just a bit edgy and stuff, so there's just that. And the other thing is I had a hearing exam. I can't afford hearing aids, so I've been told I've got to present this to the doctor and then you've got to refer me.
Had you had any suspicions about your hearing?
Oh, for a long time.
Really?
Yeah, I'm forever asking people to, you know, what do you say? I'm looking at them more and watching their lips a lot more because I run a youth club.
Oh, right.
And so a lot of background noise really interferes when I'm trying to talk to somebody.
Yeah. That's the type of hearing loss more common as people get older. Sort of in a crowded situation, the one-to-one conversation. So obviously with what you do, you must be having to do a lot of that.
Oh, there's a lot of background noise.
Sure. What? How long have you been doing what you do?
About 10 years.
Right.
So I've just
What's the age group that you have?
From 5 to 18.
Oh, right.
But you know, it's good. We have about 80 in on a Friday.
Yeah.
Maybe about 40 on a Tuesday, so it's busy.
Busy, yeah.
Busy. So there's a lot of noise going on.
I always think of like a Grover and things like what you do.
Right.
But obviously that's how realistic that is.
Well, it's not too far.
That brings back memories.
Yeah.
So you've noticed, so you felt this change over how long?
Oh, over the last few years.
And what made you sort of in the end go to someone?
I'm fed up with asking people, what did you say? What did you say?
Yeah, that's fine. Hearing loss affects more than 10 million people in the UK, which equates to 1 in 6 of the population. Having one-to-one conversations can be difficult, and so often there may be situations where patients will avoid trying to engage in conversation, or they may find themselves pretending that they can hear everything and then finding themselves in an embarrassing situation. And unfortunately, it can lead to isolation, depression, and mental illness. Have you had any dizziness?
No. I've given up smoking, etc. So I still have a few coughs and stuff. And sometimes I cough and I get really giddy. And then after a couple
Any other unusual sounds?
No.
No ringing?
No.
So I'm just going to have a look to see the drum. It's good. Let's see. Sometimes, obviously, wax is one of the risk factors, but you...
She said my eardrums were scarred or something, but...
Possibly, yeah, on the left, but not anything significant. So there is no wax there at all. So I will refer you to audiology, which is an NHS thing.
Okay.
So I'll do the referral, your prescription. Main thing is to check your medicine, so, okay? Take care. Let's see you. Bye-bye.
Bye-bye.
I need somebody to lie down and be unconscious. Right, I need your head that way, please. Your feet that way. On your back. Lie down on your back. You don't can't feel the legs halfway on you. Can you put your leg up? I'm now going to bend the knee of the furthest leg till the foot's flat on the floor. Oh, you are unconscious. Foot on the floor and then tuck toes behind the other leg. Hold the leg upright. So if you let go of the leg, it's flopping sideways. If I let go of your leg, it's flopping sideways. Hello, leg.
I'm unconscious.
You got rigor mortis by the looks of it, a bit late.
I thought I was dead.
No, you're not dead. You're alive. We're saving you. How can I help?
It's to do with my periods. This is the 4th time now I'll have been here about it.
Okay.
The last time I came, they did hormone tests because I've got hemochromatosis. So I questioned, is that causing early menopause for me? So they did the hormone test, which came back apparently clear.
What prompted you to have the hormone screen in the first place? So was it that you were missing?
It was questioning that I had a week of just brown discharge.
Okay.
Then 4 days from that, nothing.
Right.
Then I had what I'd classify as a normal period.
Right.
Yeah, and things
so they
like
were a
this
bit sort of
have been
erratic,
going.
yeah.
Yeah. I am now bleeding a lot during intercourse and afterwards. Yes.
Oh, okay. And is there pain on intercourse as well?
No pain on intercourse, but I did after. Yeah. Like an ache, like a period pain, really bad, dull period pain afterwards. Then today, I've had another big bleed about an hour ago, and I'm now quite concerned.
Yeah.
I take it you're not having your periods anymore?
No.
Okay.
No.
So when did your period stop? Have they stopped?
I think probably the last time was just less than a year ago. Because I'm busily going, yeah. And then they come back and I go, oh.
You've just described one of the disadvantages of the progesterone-only pill. It doesn't regulate your periods, and that can be a bit of a nuisance, can't it?
It can when you're sort of, your lifestyle's like mine.
Yes.
I'm never doing the same thing at any one time.
Yeah.
Do you still have periods?
No.
Well, you're pregnant.
No.
Are you having any other symptoms? No mood swings?
I wouldn't say
Should we
really,
ask
I
the
do
family that one?
If you just raise your shirt up for me and just show me the lower part of your tummy. Is there any pain in the tummy at the moment?
No, none. Okay. I did earlier today, but that came and went.
Okay. All feels normal. Just put your t-shirt back down. We'll have a chat. I mean, there's a few things we need to rule out as a cause for this bleeding. So bleeding, particularly after sexual intercourse, the commonest causes are sexually transmitted infections and sort of polyps or little growths on the surface of the cervix. Yeah. And then there are obviously more sinister causes that can sometimes be at play, so certain types of cancer in the cervix and in the womb. I think a good place to start would be to do some blood tests, including something called a CA125, that gives us an idea of the likelihood of there being something wrong with the ovaries.
Oh, okay.
If it's positive, it doesn't necessarily mean that there's definitely something wrong. It's not a diagnostic test, but it kind of gives us an idea of likelihood. We'll also check some other routine blood tests, but also we'll organise an ultrasound of your pelvis.
Right, okay.
Okay, and that'll have a closer look at your ovaries and at your womb. So you were mentioning fibroids, for example.
Yeah,
you know.
That's what I'm hoping. I
Yeah,
think.
yeah. That'll investigate any potential problems like that. I guess the last thing to consider is a speculum exam, similar to when you have the smear test done. That would be useful in terms of just doing some swabs and making sure that we're not dealing with any potential type of infection. I think it's unlikely, okay?
Yeah.
From sounds like you've got a stable sexual partner,
Yeah.
I think that's still worth doing. Obviously, in the meantime, if the bleeding comes on, becomes heavier, and you start getting short of breath, and you start having any abdominal pains, or you're passing, large clots or anything like that.
Yeah, no, they're only
come back
very
and see
small at
us.
the moment.
Yeah.
It's only very small.
They come back and see us,
Okay.
and we can take things further.
My main concern in Victoria's case was to rule out any problems with the cervix or the neck of the womb. The main things that were going through my mind were, number one, infection, but also potentially more worrying causes like cancer. After I saw the patient, we called her back and I referred her to a specialist clinic where they will perform a procedure called colposcopy, where they have a closer look at the cervix under a microscope.
Is that okay?
Yeah, thank you.
You're welcome.
D-I-E. I think I've spelled it wrong, right? If I haven't spelled diarrhea right, it's not my fault.
D-I-A, run, run, hurry, or exploding arse. That's how you spell diarrhea. Lorraine Ward. Hello. It's Dr. Hyder. Come through and have a seat. How are you?
I'm fine. This is, I've got this rash here.
Okay.
That's been going on for months.
Okay.
First of all, I thought it was like an allergic reaction to something.
Mm-hmm.
But I've been taking antihistamines and using creams and that, and nothing's budging it. And this has been on for about, I'd say about 4 months. On
Okay.
and off.
Itchy?
No, not itchy at all.
Do they become red?
They do become red.
All right, can I take a closer look?
Yeah.
Yeah, they look like little, like vesicles, like little tiny round...
What reminded me of a chicken pox.
And you've got quite a few dilated blood vessels across the nose.
It's just
there.
really affected my whole face.
Have you noticed that the dilated vessels are a new thing, or have they been there for a while?
No, I've always had them, but they've got worse.
Yeah.
And also underneath my eye as well.
This looks like something called acne rosacea. Have
Okay.
you heard of that at all? Okay.
Right.
So it's not like the acne you get as a teenager, but
Right.
typically it comes later in life, and
Right.
it can be related to flushing. So you
Right.
feel hot and you can get like a red flushing colour across your nose and cheeks and forehead and
I
chin.
do get very hot,
sometimes.
especially at work.
Okay.
All of a sudden I just get, I mean, obviously I'm coming to that age now, I'm nearly 50.
Okay. And often you can get little spots that look like acne,
Yeah.
but you think it can't be acne because you're not,
Yeah,
the
exactly.
age to
I've
get
never,
acne.
never suffered from acne.
We usually treat it with an antibacterial gel that you apply just on the affected areas for 8 to 12 weeks and see how that goes. And sometimes it can make you more sensitive to the sun. It can be genetic, so is there anyone that you know that's had it, parents
No,
or anything?
not as far as I'm aware. Is it something that's going to be ongoing or something that will probably clear up with the gel?
I hope that it will clear up with the gel.
Yeah,
but we'll
it's
see.
quite unsightly sometimes.
Okay, so you've been worried about the appearance of it
Yeah,
as well.
well, it's embarrassing, isn't it, when people, staring.
So this talks a bit more about it. So at the
Yeah.
start of the leaflet, it talks about what are the symptoms. So frequent flushing, redness, small lumpy red spots, tiny blood vessels visible.
Yeah.
And then it talks about who gets it.
Okay.
Typically appears in your 30s to 60s.
Right.
So that's the leaflet for you to have a look at.
Lovely, thank you very much. Thank you.
Take care then.
All right.
Bye.
went to bed early last night, but then I put Shrek 2 on, and I just ended up watching that.
Shrek 2? Do you know what? My daughter's just had a baby, and she's only 11 weeks old, and she's been watching Frozen with her every morning. Oh, she loves it, Mum. I went, no, you love it. I do like Shrek, though. And I still like Scooby-Doo as well.
Scooby-Doo.
I love it.
How can I help?
Well, I don't know. So they've been having blood tests because they said something about my kidneys.
Yeah.
But I've got no symptoms.
Yeah.
I feel as right as ninepence.
Yeah.
Never felt bad.
Yeah.
My biggest problem is weight.
Yeah.
So I don't know what's going on.
Okay. So do you know why we've been concerned about your kidneys?
Something to do with keratin or carrots or whatever.
Creatinine, yeah, nearly. We did some blood tests and we noticed that actually your kidney wasn't functioning as well as it had been. So it looks like we've been keeping an eye on them with blood tests, and we've tweaked your medications. I think we've stopped the
water tablet.
But we've kept you on the other one for your blood pressure. Losartan, yeah. It looks like your kidney function has improved slightly. Slightly, yeah. It's certainly not back to where it was a couple of years ago, that's for sure. What I wanted to do today, because you've been off your water tablet for a couple of weeks now, haven't you?
Been getting on for that, yeah.
So we'll check your blood pressure today, see how it's holding up. The other thing we ought to probably do is get a urine sample, because sometimes when the kidneys aren't working as well, they start leaking protein into your urine, and we can pick that up. We can send it for a test. And then we need to kind of make a plan. OK, so let's do your blood pressure first.
Right. Well, that shouldn't be very good, because what with the blinking traffic...
It'll stress you out a bit.
Oh, you're not kidding. Coming through that train...
Nice deep breaths.
And no talking.
Yeah. OK.
How is it?
It's high.
I thought it would.
Yeah. This is something we need to keep an eye on. There's two things. We need to keep an eye on your kidney function, but we also need to think about what we're going to do with your blood pressure.
You're not going to give me any more drugs, are you?
Well, so that's what we need to decide on. And...
Well, let's just try it without drugs, huh?
That's fine, that's fine. I'm not going to be in a rush to start something.
The less drugs I take, the better I feel.
Okay. So we have to balance the risk of obviously making your kidneys worse versus your blood pressure getting uncontrolled.
Yeah.
Because that's also a situation we don't want. What I suggest we do is we can get the urine sample sent off. They can book you in for a blood test on Monday.
Another blood test?
Yeah.
I'll have to come in for a transfusion, I will.
In the meantime, I'll speak to the kidney doctors at the hospital just to get a second opinion on this, yeah? So I won't add any more medications today.
No.
But obviously keep an eye on your blood pressure at home. Let me give you that bottle and the form to take with you today.
OK.
There you go.
Yeah.
So that's the bottle and the form.
OK.
So once you're done, put it all in this bag and hand it in.
To the girls. With this form, yeah?
Yeah, with that form.
OK, then.
We'll see you then.
Yeah, that's fine.
All right.
Thanks very much.
Take care.
Bye-bye.
She found out that your pulse was irregular, further to which...
There isn't much of me that's left regular these days.
It feels like someone's sitting on my chest, and it lasts until late morning.
Yeah.
It's a good thing, that Healthy Heart Club.
Yeah?
Yeah.
Quite enjoy it.
Every Wednesday we go, don't we?
In terms of normal heart's beating, it'll be like this.
Yeah.
It's like a little gallop of the heart. In your heart, it is doing this.
Oh, the other one's playing Morse code.
That's good. Sounds like a little horse, doesn't it?
I was just so pleased that he's actually got a heart.
Come in. Have a seat. Over here.
Oops.
Can I help you? This way?
Yeah, no worries. Oh, got it. Yeah, got it.
That's good. How are you today?
Oh, not too bad, mate. Not too bad.
How are things currently?
Well, I was getting some, pains in the side of the head. Felt like I'd been punched. But, I mean, that's gone. But I'm still getting probably twice a week a dizzy spell.
Okay. Do you get any other symptoms or palpitations or chest pains?
I just kind of have a wobble.
Any other previous history of heart problems in the family?
Yeah, my dad, he had a few heart attacks.
Mm-hmm.
And I think his father, he died at 46
Okay.
of a heart attack.
Mm-hmm. Let's have a quick check on you.
Shall I take my jacket off?
Yes, please. Thank you. I'm aware that you're registered blind. How much can you see?
I have a very, very
narrow tunnel
field
vision.
of vision, but my central vision is very blurred.
Blurred.
So I can kind of see you, but I couldn't describe your appearance.
Okay. I'm just going to quickly listen to your chest.
Okay.
That's great. Thank you. It's all very normal beats. Take some nice deep breaths. Perfect. Thank you. The heart is beating pretty normally now, but looking at results here, there was just one episode of 8 beats of irregular beating, which means when you had that episode of dizziness and feeling wobbly, that's when the heart was beating in a rogue fashion.
Right.
If the same gets prolonged for more than 30 seconds, then the heart starts to completely fibrillate. And you'll have collapse, and sometimes some people have sudden cardiac death as well.
And how can I help you today? Is it your eye?
Yeah, I woke up like it. It was quite like, sort of like pussy almost. But I just thought, oh, it was a bit of sleep. Then I looked in the mirror and I was like, oh, okay.
Hello, little one. Is that shiny?
Okay. The vision in my right eye is completely deteriorated.
Okay.
I mean, I can see, but there's no sharpness in it.
It's dry over here.
Yes.
Ah,
Okay.
a tear coming.
The tear's coming. Okay.
Looking at results here, there was just one episode of 8 beats of irregular beating. So we need to nip it in the bud, get further more testing. We call it as electrophysiological studies. Hence, I need to refer you to the cardiologist.
Okay.
Any questions today? Are you okay with the explanation?
Yeah, is it, I'm okay to carry on as normal, yeah?
Carry on as normal. However, you probably would be better off staying away from any danger like water, fire, those sort of things.
No, see, I do a bit of weight training.
Okay.
Am I okay to carry on with that?
I would advise you to stop lifting any heavy weights for the moment until you see the cardiologist. You can still keep active, but no strenuous activities, that's what I mentioned. Yeah. Okay?
Yeah.
That's your...
Cane, okay. Oh, thank you, sir.
In the meantime, if you develop any further worsening, like chest pains or palpitations, you need to come and see me.
Yeah, all right then.
All right?
Thanks.
All the best, sir. Take
you.
care.
Take care.
Bye-bye.
Out to the left, isn't it?
Yes.
David's mother had 3 children. April, May and...
June.
What about David?
Come right in. Good. So this is Aaron. What can I do for Aaron?
Poorly, bless him. Firstly, he keeps rubbing his ear.
Right or left ear, or do you know which one?
A bit of both. So
Okay.
I did think it was just because of teething.
Yeah.
But looking at it this morning, looks very waxy at the same time.
And how long has he been rubbing his ear?
Oh, ages.
Okay.
And then his breathing's just atrocious at the minute.
Any family history of asthma or anything
Only
like that?
my brother, possibly his older brother.
You mean Aaron's older brother?
yeah.
What age is he now?
He's 6 now.
Okay. Is he eating okay?
Less than usual,
Yeah.
but he is
He's
still
eating,
consuming,
yeah. And his bowels and his urine and so on, they're all okay?
Yep.
So just going to look in your ear, Aaron, now, just to see what we can see. That looks pretty good.
The other one.
Okay.
It's a bit gooey this morning.
Doesn't it look a bit gooey? Yes, it is a bit gooey, you're right. What's in there is debris, it's dead cells, and the body responds to infection by oozing.
Okay.
So it's that ooze, it's dead cells, it's some pus cells from the immune system to go and fight the infection. Now let's listen to his chest. He's obviously a good grubber. He eats well.
Yes. Which is quite unusual because at the minute he is being quite a fuss pot, but he does
You've
normally
been a
like...
bit of a fuss pot. You a good boy?
He is generally a very good boy. Just
Yes.
last couple of nights have been extremely hard. I think we've had about 2-3 hours sleep per night.
Ah, right, yeah. And we just want to see his throat. So just one arm around his arms and one arm around his forehead. That's right, I know, but don't you worry about it. That's it. Yeah, yeah. So he has an infection in his chest and an infection in his throat and an infection in his ear. But he's also a bit heavy.
Am I feeding him too much?
I think so, yeah, I think so. It's not always easy for a doctor to raise the fact that a child is overweight with the parent because there's an implied criticism or the perception that the doctor is criticizing the parent when that isn't the case. The doctor has an obligation to draw to the parent's attention any problems that are being stored up for the future.
What can I do about his feed? Because even I know for a baby he does feed a lot. So he'll have breakfast milk, lunch, dessert milk, dinner, dessert milk.
Yeah. I think just begin to restrict the amount he takes of each food. So put out less for him and less feed. Maybe dilute the feed slightly so you have the same volume, but just less food in it. Just miss out a scoop.
Okay.
And then of the solids, just give him smaller portions and just gradually restrict it that way in a way that he won't notice.
Okay.
Yeah, because he just likes his food, and some of us do. And, you know, It is okay to deny a baby food when they're taking or getting more than they need. There are times when you have to take that bottle away. There are times when it's better for the baby or the child to take that plate away. The body wasn't designed to use excessive calories in any sensible, healthy way. The ear drop, I want him to take 3 drops into the right ear for 10 days.
3 drops right in 10 days.
Yeah, it'll all be on the thing.
Thank you so
I'm sure
much.
you will.
Thanks a lot.
Bye-bye, Aaron.
Say bye.
Bye-bye.
Bye.
Bye-bye.
Brilliant. Thanks to you.
You're welcome. Nice to see you. Bye.
Take it easy. Bye-bye.
Thank you very much.
You're welcome.
Say bye, Andre.
Okay, thank you very much.
Take care. Bye.
Thank you. You take care.
Thank you, Dr. Bolger.
Thanks a lot.
Take
All right,
care.
then, take
Thank
care.
you.